in the heart of Yorkshire.
Hello, Mr. Band.
An unbeatable team.
That way.
And stop, we're going to lay you down.
Hard at work 24 hours a day.
Does it count as my daily exercise?
7 days a week.
I can smell it now. It's a really bad burn.
Saving lives.
It might be that we need to put you to sleep in order to try and sort this out.
Helping loved ones.
It's a shocker, that.
Making the community they serve better.
We got you, lad.
You're being such a good boy.
A health service treating anyone.
Car door, house door.
Van door.
Big van door.
Yes.
So it's quite impressive, isn't it?
And everyone.
Oh, you're going to have a good black eye.
Are you a doctor?
A team doing anything and everything for each other.
It's just been mental down here. I will do it, I'll get to it.
We're strong people in Barnsley, you know.
This is Barnsley Casualty 24/7.
You're absolutely all diamonds. Brilliant.
We fixed him.
On shift tonight, Sister Jane.
I just look at them pouring in and I just think, oh my God.
Dr. Phil Taylor.
Going to see a massive kidney with a massive stone.
And emergency nurse practitioner Darren.
Just try and relax, sweetheart.
So, get ready to share a shift with the team at Barnsley Casualty.
You eat wars, ain't ya? This one in Resus, it says they're just awaiting the porter.
Yeah.
Hi, it's Jane.
It's mid-afternoon, and Sister Jane has just started her shift.
That lady in cubicle 5 can go to 36, but she just needs an x-ray en route if Olivia can take her up when she goes.
Casualty is already gridlocked.
She's going to breach, otherwise I'm going to have to send her up.
Sister Jane needs to move patients out of A&E.
So she's going to breach in 45 minutes.
But there's a staff shortage in a crucial department.
Patients are breaching because there's no porters, so it just means that you've got like 6 and 7 to take up to the ward and no porters to take them up. We need a certain amount to be able to run efficiently and effectively, and we're just stretched to every end.
Without porters, she's struggling to move patients out. But there's no let-up on patients coming in.
Hello, Barnsley A&E.
An 87-year-old is being blue lighted in.
Straight into Resus then, please.
He's struggling to breathe. Dr. Phil Taylor prepares Base C in Resus with student Dr. Ewan.
Old chap sat on the toilet today, couldn't get up. He's alert, but has got a low blood pressure. I was thinking most likely probably chest infection. That's plasma. Could be a bit of heart failure, but you try not to form too much of a picture really, because anything can walk through the door. Probably all infection driven. But they've not been able to cannulate him. Sounds like this is him. Yep. 1, 2, 3. Okay, if I sit you up a touch.
Yeah.
Make you a bit more comfy.
Thank you.
Is that all right? My name's Phil. I'm one of the doctors. I'm going to be looking after you today, all right? I thought he looked quite unwell. He came in looking very pale and was quite breathless. His heart tracing showed that he had an irregular heart rhythm. This one looks quite regular, but this one looks a lot more irregular, doesn't it?
We've had 4.
Yeah. His heart rate was going a lot faster than usual, and that can be driven faster by, say, an infection.
We've given him a nebuliser for his chest, just to see if that's going to help him. And his stats dropped to 86.
Yeah, you're a little bit cold, aren't you?
And that's... Oh, this is Ralph.
All right.
Ralph has come in with a complex set of health issues.
So just been generally unwell the last few days?
For a month.
For a month, all right.
Any movement,
Yeah.
and I've been out of breath.
Any movement whatsoever?
Yeah.
All right. Have you had any chest pain at all?
No.
When there's this many conditions going on, you do have to be quite careful and think quite carefully because you potentially can make the situation worse. Right, just going to try and get a cannula.
Dr. Taylor wants to run a series of blood tests.
Your blood's definitely taking its time to come out.
Yes.
You get this a lot in the elderly population. Their veins are quite snaky, they break down very easily, and so they don't have as good flow in them. Right, I'm going to have another pop at the other side, I'm afraid.
Right, okay.
Oh, I can see a good vein on this arm.
Right.
Should have started with that one, shouldn't we? Oh, that was a much easier cannula. Just going to get one more sample, sorry. 1, 2, 3. So we're going to send off some blood tests. We're going to get you a chest x-ray.
Right.
So I'll just get all that sorted.
Ralph is very unwell and can't leave Rhesus.
Right, you actually take some big deep breaths in and out, please.
Dr. Taylor and his team will need to closely monitor him.
Ta, love.
In the hub, the pressure on Sister Jane and her team is rising.
I've got patients to move and no porters.
A shortage of porters has created a backlog of patients in Casualty. And one of the porters has also been held up with a patient.
Right, so he's been taking that patient for the best part of an hour.
People aren't moving out, but they still keep coming in.
The doctor wait has gone up to 3 hours.
And now there's another patient waiting in reception. Karina has walked in with husband Darren after dislocating her shoulder getting dressed this morning.
It's so painful.
She's only just got over a dislocation in the same place after falling down a flight of stairs on holiday. She still has the face scars and a broken arm from that trip.
It was 3 weeks tomorrow that I fell. And there was a Prosecco waiting for me at the bar and I never got it. This is the last thing I need, the shoulder out again. Because it's the most painful thing ever.
This is the 5th time she's dislocated her shoulder.
You know, you think a break is painful, but your shoulder being out is just horrendous.
On the way to triage, Karina bumps into her best friend Helen, who works as one of the hospital receptionists.
I've not got my lipstick on.
Don't matter. I've known Karina for 20 years. She runs a local nursery and she's looked after all my 3 children, so we're best friends. She's in a bit of a mess, bless her.
Repeated dislocations could mean that something more serious is wrong with Karina's shoulder.
Where's the porter?
Sister Jane is wrestling with a gridlock department due to a number of porters being off sick.
This man in 3 has been waiting ages to go up to the ward.
One of the porters on duty today is Luke.
We're just really short of staff. Really short, so it could delay transfers, it could delay CTs or X-rays.
But the patients keep arriving.
How many walk-ins have you got?
I put 2 in up.
There's no one to do them.
Ralph, right, just have a quick listen again.
Back in Rhesus, Dr. Taylor is continuing to monitor Ralph, who has low blood pressure and is struggling to breathe. Daughter Janet is by his side.
Can I get you to sit up for me? Good man. All right. Nice deep breaths, as deep as you can.
In addition to his current symptoms, Ralph suffers with a long-term health condition, which leaves his heart weak.
Again, it's entirely possible that the heart failure is contributing to his breathlessness. So as the heart gets more tired, it pumps less efficiently and fluid can collect in the lungs. All right, well done. You can lie down. You can definitely die from fluid collecting on the lungs. And usually if someone has a history of heart failure and they're breathless, you would have that in the back of your mind as a potential diagnosis.
Dr. Taylor needs to treat Ralph for possible fluid on his lungs.
You've got low pressure there.
Has he? In patients who have low blood pressure, you're in a constant balancing act between increasing their blood pressure by giving them fluid, but also not giving them so much fluid that their heart can't cope with it, because then all this fluid builds up in their lungs. His chest sounds pretty clear. I'm going to start this fluid, actually. If someone's blood pressure on the low side, it means not enough oxygen gets to the brain, and so that was the most pressing thing to solve, really. Right, just going to give you a trickle of fluid, all right, because your blood pressure's a tad low. Do you feel dizzy or anything? Do you feel dizzy or lightheaded?
Yeah.
A little bit dizzy.
Treating his low blood pressure by giving Ralph fluids could flood his lungs. The next few minutes will be crucial.
He's going to 35, yes, love.
In the hub, Sister Jane is overcrowded with patients and not enough porters to keep them moving on.
Pass me a sticker that says in X-ray. When you're running a shift like that, it is very difficult. I've probably got a department of 60, 70, 80 patients. You know, your mind is just going on and on and on, and you try to do 10 jobs all at once.
And another patient is on their way. An 83-year-old is rushed in after having a fall at home.
Is it right if I scooch you back a little bit, actually?
Sally's sent to cubicle 8 with her grandson's girlfriend, Katie.
It's a bit harder hearing.
Dr. Amber Mitchell needs to know more.
Nice to meet you.
Nice to meet you, love.
All right. Can you tell me a bit about what's brought you into A&E today?
Yes. I was just pottering about in the house, and all of a sudden I landed on the floor, and no warning either.
And what were you doing at the time when it happened today?
Nothing, I was just sat on the settee.
So you were sat on the settee and then you stood up, did you?
Mm-hmm. And all of a sudden she fell. Just fell, dinted all the wall.
Oh, bless you. Okay. What hit the wall?
There.
Just the back of your head?
Yeah.
When anyone has fallen and hit the head, one of the worst things that we worry about is a bleed on the brain. So we do quite a detailed examination.
This side of my face went a bit funny. You know, I thought, oh, I hope I ain't had a stroke.
Okay. And how long did that feeling last for?
3/4 of an hour.
Any weakness down one side of your body?
No, only thing that'll hurt is my backside, because I fell on my bottom.
On your bum on the way down, okay. And any changes in your speech at all?
No.
No, okay. Did anyone say if you lost consciousness at all?
No, they didn't.
No,
I never do.
Has this happened a few times then?
Yeah.
Okay.
As I was talking to Sally a little bit more, she explained that she's actually had multiple falls, and that's something I worried about more.
And how often has this been happening then?
Oh, I've
done it a few times, haven't you? I don't know what it could be.
Okay.
Sally's recent falls could be the sign of a more serious underlying condition.
Olivia, can you do me a favour, my darling? Will you work with Luke and just do back-to-back scans for me?
With long waiting times today and a shortage of porters,
It's Darren, nurse practitioner.
helping Sister Jane to keep the department moving is emergency nurse practitioner Darren.
Come in. Is it Karina?
It is, yeah.
Come and have a seat.
His next patient is Karina, who's nursing her 5th dislocated shoulder.
So it's that side, not that one.
All right.
Left.
Oh, yes.
Yes, there
Yes.
it is, yes.
Okay. So, just need to get an X-ray. to make sure there's nothing untoward other than it's out of joint, which obviously is.
As an emergency nurse practitioner, Darren never knows what will come through the door.
I generally see something interesting every day, learn something every day, but we deal with some quite horrendous injuries, shoulder dislocations, nasty fractures that we now manipulate and put back. Whereas in years gone by, when I first started, a dislocated shoulder might take 3 or 4 hours and need a resus space.
Rena, do you want to come in, darling? Hello.
Radiographer Ashley will take Karina's x-rays.
Just come and stand with your back against the board for me. Oh, sorry. And then just shuffle right into the middle of the board. Lovely.
This is a dislocated shoulder. Anybody, even without a medical degree, would be able to see that that's not in the right place. This part should be sat in the glenohumeral joint, which evidently it's not.
It's even painful to walk.
To be honest, they do say that dislocations can be worse than a break.
Do you want to get the door down?
They can sometimes cause a lot more pain because it's more ligaments.
Karina's dislocated shoulder needs to be put back in its socket.
Thank you, bye.
In Resus Base C, Dr. Taylor is treating Ralph, who has a wide range of complex medical conditions.
Hold on.
So we've given you a shot of antibiotics to cover you for any chest infection. The X-ray team are going to come around and get you a chest X-ray, because it could be that you've got fluid on the lungs.
He's very ill, so the radiographers come to him.
See, you do an X-ray on your chest, alright? Okay. That's it, sweetheart. Sit back on the chair. Just relax your shoulder down. Pop your arms down by your side for me. Breathe in, hold it there. Breathe away.
Let's wrap you up.
Ralph's struggling to control his temperature, so it's difficult to monitor his SATs.
The way that the oxygen probes work is they attach usually to your fingers or your toes. If patients are really cold, the body's way of naturally dealing with that is to close off all the blood vessels that go into your peripheries. So it's going to read a falsely low oxygen tracing.
But Nurse Amy has a solution.
It's a hot water bottle. It's a makeshift hot water bottle. It's just hot water in a glove. I told you my water bottles work. You got warmer hands than me now.
I don't think so.
You do? They're lovely and warm. We have some sats, Bill.
Brilliant. What do you reckon?
And now the X-ray results have arrived too.
You're going to have to be careful with this fluid because this line here basically means that there's fluid in the horizontal fissure. So that suggests that he's got fluid on his lungs. He's also just got probably a bit of infection, so there's quite a lot going on.
With so much fluid on his lungs, Dr. Taylor must reduce the saline level going through his drip.
Can we just give this slow in like a bag of just 50 mils of saline or something?
Ralph is critically ill. But Dr. Taylor and his team are doing everything they can. In reception, Karina is waiting to have her dislocated shoulder put back in its socket. Best friend and hospital receptionist Helen is on hand for support.
Karina, please.
Look after her, Darren.
Always do. Come in.
Karina, are you alright? Do you want me to come in?
We actually do need a hand, Ellen, if you want mine.
Yeah.
Right. Are you happy to help?
Oh, this is my bestie.
Right.
So yeah.
What I need you to do is relax. Hold your finger over that. The green whistle thing, it's a type of anaesthetic really. It's just breathed in. Deep breaths in and out. Might make you cough to start with.
Right.
Keep going though. I want you to really go up. That's it. sweetheart.
Emergency nurse practitioner Darren tries to manipulate the shoulder back into position.
Alright. There's lots of different techniques to pop it back. I prefer a technique called the Spazo method, which is basically pulling it like that and turning it out a little. And sometimes you can give it a little gentle nudge by putting your fingers in the armpit and pushing on the head of the humerus.
You're alright, you're alright, you're alright.
Just try and relax, sweetheart. Go on, keep going with that.
Alright, keep reading this.
Keep going with that.
Keep breathing. Come on. Keep breathing. Keep breathing it.
It's okay. Right. It's not going to go back in straight away, this one. Might get you a bit more relaxed.
The manipulation hasn't worked.
Sorry, sweetheart, I want to have another go in another way. Yeah?
That's okay.
Yeah, I'll let it come round a bit.
Okay.
The medical team are going to have to try a different tact.
I love you too.
I love you so much.
Oh, I love you too. You're like been out on a bender.
I feel like I've been out on a bender. I wish I got my lippy on.
Are you okay to walk again now?
I think so, yeah.
Unable to get Karina's dislocated shoulder back in place, emergency nurse practitioner Darren hands over her care to the resus team.
Come on, love.
Oh, you never thought you'd have to do this to me.
The medical team in resus work to reset Karina's shoulder. If it won't go back in under sedation, she may need surgery. At Barnsley Hospital, Sister Jane has a backlog of patients waiting to be moved out of Casualty.
There's 4 ambulances on my corridor.
I know, and there's loads of walk-ins.
Due to sickness, there's a shortage of porters.
When we are short-staffed, it's massive, but we all muck in and do things together.
So it's all hands on deck to get the department moving. Back in resus, Ralph is struggling to breathe. He's got fluid on his lungs, and his blood pressure is dangerously low.
His bloods have actually just come back this moment, so he's got an HB of 56 confirmed on his full blood count.
HB, or hemoglobin, is found in your blood. It carries oxygen to the heart and the brain.
When his blood tests came back, his hemoglobin was quite profoundly low. It was about 50. Usually a healthy person would have a blood count of, say, 120 to 130, 140. So his was well under half of what it should be.
The blood tests also found a high level of urea.
Brilliant, thanks very much. Urea gets raised when blood gets broken down by the body, and that would happen when you bleed into your stomach or into part of your intestines.
The results of the blood tests all point to one thing. Ralph has internal bleeding.
His bleed is more than likely what we call a chronic bleed, so it's a small trickling bleed that has been going on for months. His body has slowly been able to accommodate to this to a degree, and it's then got to a point where his blood pressure has started dropping and he's started becoming unwell.
Ralph needs an urgent blood transfusion.
I think the real thing that's going to make you feel better is getting some blood into you. All right, that's the thing that's really driving everything at the moment. So what I'm going to do is we're going to transfuse you 2 units of blood. All right. You've got more blood pumping around your body, you can clear toxins, you can deliver more oxygen, and it just improves the situation in all ways. Hi there, can you put me through to blood bank, please?
The blood transfusion may stabilise Ralph's condition, but medics need to urgently find out where his internal bleed is coming from and stop it.
It's alright if I have a little listen to your chest.
Hello.
Back in cubicle 8, Sally is undergoing a series of tests with Dr. Mitchell.
Can I have a little listen at the back, love?
Her grandson's girlfriend, Katie, brought her in after a fall earlier today.
Right.
It's not the first time Sally has taken a tumble recently.
When was your last fall then?
Last week.
Last week?
I fell about 3 times, haven't I?
Yeah.
A bit more. I fell down getting papers in.
You was, haven't you?
Yeah.
Sally's been falling, especially after standing up, and that can be a sign of a condition called postural hypertension, which is where your blood pressure drops on standing.
Can I just bob this around your arm?
Postural hypertension is quite an easy test. Basically, we lay you down, we test your blood pressure, and then we stand you up and we repeat it again. And if there's a big drop, then we say you've got postural hypertension.
Oh, there was a bit of a drop there.
Oh, what's happening now?
There's a bit of a drop there, Sally. Have a seat for me. It might be why you've fallen.
Dr. Mitchell must find out why her blood pressure has dropped so dramatically.
Have you had any infectious symptoms at all? Any temperatures or coughs, colds?
I've had, the doctor said my blood pressure was high.
Low. You had a
Low
blood pressure,
blood pressure. And I've had the tablets for it, haven't I?
So when she started taking these tablets, she went a bit dizzy.
Okay, so you had a change in your tablets. You were feeling a little bit dizzy.
Yes.
The difficulty is sometimes it's hard when we start you on a new medication to know exactly how it will impact you.
That's what's making me fall easy. Is it?
Potentially, and that's one of the things that we review. Are there any medications that we can take out that might reduce sort of side effects that could cause you to fall?
Yeah.
Have you got any questions for now?
No, love.
No, all right.
If you want to go home, it's time for Emmerdale.
Okay. What time is it on?
7:30.
Or I think we might be pushing it, but we'll see.
No, I only live 10 minutes.
I've got a lot of time for elderly patients. They'll have a little joke with you as you go along, and they're often a little bit more entertaining.
I've got some good news and some bad news.
Oh dear.
All right. The good news is I think we know why you've had the fall, okay? And I think it's because when we did that test, your blood pressure dropped significantly. Now, because it's dropped by such a significant amount, the safest course of action is probably staying overnight to get you seen by our specialist team that are really good at assessing a person and hopefully prevent further falls as well. Does that make sense? It's not really what you wanted to hear, is it?
No, love, but can't be helped, can it?
You might miss your episode of Emmerdale.
I may have.
I'll try and get it on catch up for you. It's best off to, for you to stay here and just get checked out, isn't it? And make sure you're all right. Let's just get you better.
Sally spent the night in hospital where doctors adjusted her blood pressure medication. She went home the following day and was able to catch up on Emmerdale.
"72 patients in the department."
With such a high backlog of patients in casualty and not enough porters,
Hi, it's Jane down in A&E.
Sister Jane makes a call for extra help.
So I need to know how many porters have I got, love? Meant to have. Right. Who have I got? Because at the minute I've got Luke and Darren's gone for his break. He's not good enough, really. Thanks, love. Bye. It's about ensuring that patients are safe, making sure that they don't know that we're short-staffed because they're there to concentrate on getting better and receiving the treatment that they need in a timely manner.
All sorted?
Yeah.
In Rhesus Bay B, Karina's dislocated shoulder has been put back in its socket.
I feel so much better.
I'm going to have to spoon feed you.
Helen's my parent.
Yeah, I've got my work cut out with you.
Karina must now go for a second x-ray to check the bones have gone back together correctly.
Can I peel these ones off the legs?
Ready?
Ow!
So just stay nice and still like that, okay?
Radiographer Ashley compares Karina's x-rays.
Here we've got Karina's initial x-rays showing that it is dislocated. And then this is the newest images that we've done after manipulation, perfectly in joint.
Karina is good to go.
I'm not seeing you off at premises here. Whatever you do, don't fall down out here. Right, Darren.
Right, see you later.
Watch that curve. Yeah, will do.
Karina returned to hospital a few days later for a CT scan of her shoulder. It was decided that she'll have corrective surgery, so she won't have to suffer a sixth dislocation. Ralph is about to undergo a blood transfusion.
Right, sweetie pie, I've got some lovely blood products for you, which is nice and cold, so I'm glad we've warmed you up first.
The core of the resuscitation room is to stabilise an unwell patient.
You see it running?
Giving him blood is a stopgap because ultimately you need to find where he's bleeding from. We're going to give you this bag of blood, all right, and then given your blood pressure's come up a bit, we're going to get you up to the medical ward and they're going to give you the second bag up there, all right? All right. That's what we've done in his case. We've made his blood pressure better, we've given him some blood, and then we'll send him onto the ward and he'll have further investigation and find out the cause of the bleeding and stop it.
The transfusion has an immediate effect.
Good job. Your colour already looks better. Yeah. Fantastic. Good stuff, all right. Glad you're feeling a bit better. I imagine you'll be in for a few days. It may be that they have a discussion with you about doing a camera test to see if there is a small bleed somewhere. All right.
I was happy about that one, but
Yeah.
I was sat on the toilet when this problem was starting.
Yeah.
So it's not
All right.
very good down there.
All right, so we'll give you this bag of blood and then we'll get you up to medical ward. All right? But nice to meet you and all the best. All right.
Ralph is moved to the acute ward, where he will get a second bag of blood. Further investigations revealed the bleed was coming from his kidneys. He spent 14 nights in hospital.
Did that patient go to 35 with the shoulder? Just go in now, Tarlo.
Sister Jane has managed to get hold of more porters, and the backlog of patients in Casualty is starting to move. Over in paediatrics, Nurse Ellie collects the next patient from reception.
Come on then, mate. Should we have a look round here? Yeah? You've been playing in waiting area.
Harry has come in with his mum Rebecca after an incident at nursery.
He's been playing with a plastic funnel. He's put it in his mouth and bumped into something, so it's hit the back of his mouth, so it's caused a laceration. Right. Like at the back here at this time. So if you just open your mouth nice and wide for me, darling.
Oh yeah, can see it's up there. Is it sore? Yeah.
Yeah. One of the lots of blood. Yeah. Has he had a drink since?
He has. He's had cold water and they give him a nice pop at nursery.
Super. But anything nice will help that area, stop it bleeding, which it has stopped it from bleeding.
As it's such a deep wound, Nurse Ellie checks all of Harry's vitals to see if it's infected.
Pop this on your finger first. And then we just need to wait and see the doctor. Is that okay?
Are you a doctor?
Am I a doctor? I'm a nurse. Is that from your dinner? No, is that from the blood? Oh dear.
Put this on your arm just here. That's it, good lad. This one, punch your muscles up. See how big and strong you are. So keep your hand nice and still for me. That's nearly done. If you look at mummy for me. Boy. It's all done now. I feel better. Right then, super stuff. So, if he's in pain, let us know and we'll get him a bit of Calpol. Yeah. Excuse me, can you wait for me? Okay. All right. Thank you. Thank you. Yeah, you really go back and sit down.
Harry will wait in reception to see the doctor. Juggling a busy day, Dr. Phil Taylor is now in cubicle 7 with Pew, who has back pain.
It happened last week, but this week it's last 2 days.
Okay.
And it's getting worse now.
So just run through a few other things. Have you been sick at all?
Not sick, but it's kind of like
You feel nauseous. Okay. All right.
Pew has a history of back pain.
So it was about 2 years ago you had this back pain, and you had a CT scan at the time, didn't you?
Yes.
I had a look on your scan. You did show that there was a little bit of pressure backing up into the kidney, which usually means that there has been a blockage further down.
Dr. Taylor has a hunch that he knows what it is.
Are you all right to jump up in the bed and I'll have a quick feel of the back?
Yes, sure.
Kidney stones are a solid collection of usually calcium, and they form these distinct stones that get trapped in the tube that connects the kidneys to the bladder. Because of this blockage, all the fluid that's coming out of the kidneys can't go anywhere because the stone is acting like a dam, and that pressure builds up and goes back into the kidneys and makes it swell. I'm just going to feel through to the back, and it's mainly on this right side. Sorry, your right side.
Dr. Taylor examines Pew to feel if there is any swelling of her kidneys.
I'll try and be gentle. Is that sore up in there? All right. And any pain when I'm pressing above the bladder there? No? Okie dokie. Right. If you sit yourself up for me. What we'll do is I'll get you some good painkillers. I'll wait for your blood tests to come back. Got any questions? No.
As long as I got a painkiller.
Yeah, we'll get you pain control, don't worry, Emily. All right? Kidney stones are probably one of the most painful presentations that we see, and they're often writhing around in really significant pain.
While she waits, her blood tests are back.
Her bloods are all completely fine. CRP and infected markers are fine.
Pew is still in agony, so Dr. Taylor orders an urgent CT scan.
Kim, 35, not 33.
At Barnsley Hospital, Sister Jane is managing a congested casualty.
He's going to breach shortly if I can get him up. Lovely, thanks very much. Cheers, bye. Right, he can go.
But the extra porters drafted in are easing the backlog.
You're trying to get flow within the department, so you just have to pull from other areas. It's like you pinch from Peter to pay Paul.
In reception, Pew's back pain is increasing.
CT, KUB.
She's been for a CT scan of her kidneys.
Here's her 2 kidneys. This one has this big swelling on the outside of it that it doesn't have here. You can see a massive kidney with a massive stone. And this big thing is a stone, and that's blocking all the urine from flowing out of the kidney and produces this big swelling, which is why she's so sore.
Pew's pain is now so bad, she leaves the waiting room to find Dr. Taylor.
Hello, my dear. Is your pain really, really bad? All right. Let me just find you a cubicle. Take a seat or lie on the bed, whichever you prefer. Here we go. So, just a bit of an update. So, Your CT scan has shown that you've got a kidney stone, and like last time 2 years ago, the kidney has swollen because of all the fluid in there, okay? The treatment of kidney stones, they can either pass by themselves, which is probably the more common scenario. So patients will get this pain and then the body will basically squeeze this stone out. If they're larger and they're creating significant blockage, they sometimes need to be surgically removed.
The pain isn't coming up here now.
Yeah. So what's happening is the tube that the stone is stuck in is trying to squeeze against the stone, which is why it's getting really sore. We're going to get you some anti-sickness and we're going to get you some good painkillers. We're going to get you some IV morphine, all right?
Hello, I'm Ellie. I'm one of the nurses. Have you had morphine before?
Yes.
You have? Might make you feel like you've had a couple of beers or a few gins.
Well, I don't want to get a real gin.
So we give morphine quite slowly because obviously it can make you feel a little bit funny. Might take a couple of seconds to kick in. Feel okay? Feel better? Yeah? You can feel it working?
It's a bit, but it's here that's really bad.
Yeah?
Pugh's admitted to a ward where her pain can be carefully monitored and treated. She stayed for 2 nights before being transferred to Sheffield, where she had surgery to remove the kidney stone. Back in paediatrics, Harry has come in with his mum Rebecca, with a cut on the inside of his mouth. He's been seen by Nurse Ellie, who's referred him to advanced paediatric nurse practitioner Angeline.
Right, so we need to have a look at you. Let me sit down. My hands are washed.
I need to bed.
Can you sit on the bed? Oh, you want to sit on the bed? Sorry, sweetheart. Yes, you can sit on the bed. Your shoes are on the wrong feet. You've got bendy feet. Does that hurt anywhere? That's just in there, is it? Open your mouth really, really wide for me.
Yeah.
Ooh, that'd be sore, isn't it? And can you roar like a lion at the same time? Go. Ah, that's it. Oh, that's brilliant. Well done. So he has got quite a deep laceration behind his teeth, just into the gum. All right.
Advanced paediatric nurse practitioner Angeline gets a second opinion from consultant Dr. Asim Salim.
Hello, sir. Hello, Madam Doctor. Can I have a quick look in your mouth? Can you open your mouth big? Super. That's a pretty big hole there. Okay, now tiny small wounds in the mouth, we usually ignore them because they heal very quickly. This one is probably just way bigger than something which I will completely ignore, right?
Yeah.
Okay, yeah, so that will need assessment and maybe possibly closure, right? Okay, so what we'll do is we'll have a chat with the maxillofacial surgeon, see what they say, and we'll take it from there. Okay, yeah.
Open really, really wide again.
Harry was referred to the facial surgeons,
That's it, perfect. Keep there.
but fortunately by then, his mouth was already healing well. It's been tough, but as Sister Jane's shift comes to an end, flow in the department is under control.
Nina, it's only Jane down in A&E, sweetheart. I've got a lady for you.
But it's still busy as she hands over to the next shift.
It's going to be a little bit of a difficult night for you. Currently, you have 72 patients in the department. It's a 2.5-hour doctor wait. We have good days, we have bad days, and we deal with the bad days and enjoy the good days.
Sister Jane heads home.
See you later. Have a good night.
The new team head to the department
Take care, everyone. See you tomorrow.
because the doors to Casualty stay open 24/7.